Also from the pharmacy department here at Care Oregon, I'd like you to welcome Melissa Brewster, Senior Pharmacy Clinical Coordinator at Care Oregon. Melissa spends a lot of time working in the coastal community care organizations in Clatsop and Columbia counties and Tillamook County. She is all over the place in the coastal environments there. She is a board certified senior pharmacist and provides her clinical expertise on substance use disorders and illicit drugs to Care Oregon and its affiliates. This is what I think a lot of you have been waiting for. This is your overdose response training. I hope we never have to use it, but it's wonderful to know how if we ever do. This is incredibly important info. So I'm super excited to welcome Melissa with us here this morning. Thank you, Melissa.
Hi, good morning, everyone. Thanks for attending our MedZed today. My name is Melissa Brewster, and I'm a pharmacist here at Care Oregon. And I'll be talking about Naloxone rescue today and how actually to respond to an opioid overdose. And this is good information not only for your patients and your clients that you can share with them when you're dispensing or prescribing Naloxone, but also in case you yourself ever have to respond to an opioid overdose. So we'll talk today a little bit about what happens in the body during an opioid overdose, what exactly is naloxone and how it works. We'll talk about how to recognize an opioid overdose, what are the signs and symptoms that you'll see in the body, and then what is the sort of order of events of how you would respond. So a few of the basics of opioid overdoses. Really, humans or mammals can overdose on pretty much anything, including water. And so whenever you take a toxic amount of a drug or a substance into the body, you can overdose. An opioid overdose, however, causes the body to stop breathing, reduces the drive to breathe, and it happens minutes to hours after the opioid is taken. Within 3 to 5 minutes of not breathing, brain damage starts to occur. And so it's really important to get that person to return to breathing, either through supplemental oxygen or through administering naloxone. Naloxone is also called Narcan, it's the brand name. It's been used as the gold standard of reversing opioid overdoses for the last 50 years or so. And it's an opioid antagonist, meaning it directly kicks the opioid off of the receptor. And it pretty quickly counteracts the respiratory depression that's caused by the overdose, allowing those people to breathe again normally. If somebody doesn't have opioids in their system, the naloxone really doesn't do anything. So it's safe to have in first aid kits, and it's safe to have around children or in your home. Historically, it's been used by EMS or first responders, but now it can be used by lay people as well, given some of the new Good Samaritan and naloxone laws that are on the books in almost all states. There's no potential for abuse of naloxone. It's not a controlled substance. And there are different strengths of naloxone based on the formulation. So the injected intramuscular or intravenous solution is a different strength than the intranasal. So what are the signs and symptoms of an overdose? So if you were to encounter somebody who was extremely intoxicated with opioids, they may be nodding off or have slow breathing, and you may be concerned that they were overdosed, but really there are pretty clear signs and symptoms of an opioid overdose. So loss of consciousness, so they shouldn't be responding to you at all, even if you're trying to stimulate them or yelling their name. Their breathing becomes very shallow and somewhat erratic. The skin starts to turn a blue color or a gray or ashen color, given the body is losing oxygen. Sometimes you'll hear a choking sound or a snoring sound. Oftentimes there's vomiting, the body goes completely limp, their face becomes pale and their hands become clammy. And sometimes you'll also see the colors of the fingernails start to turn as well as the skin. So what are the steps in responding to an overdose situation? So first of all, doing that assessment, are they breathing at all? Are they responsive? Are they answering when you yell their name? Or can you give them a sternal rub, so a hard rub in the middle of the chest with your knuckles? If somebody doesn't respond after that and they're not breathing, you tell them that you're going to call 911. Sometimes that may alert somebody because they don't want law enforcement to be involved, and tell them that you're going to give them naloxone. So the second step in responding to overdose is to administer naloxone. Some people say that you should administer rescue breaths, 1 or 2 quick breaths before you administer naloxone. And then some programs say to administer the naloxone first and then to start rescue breathing. There really is no wrong way to do this. With the nasal naloxone, you'll put the device all the way up into one nostril, and you have to press pretty hard to administer the naloxone until you hear it click. The person doesn't have to be breathing or inhaling the naloxone in order for it to get onto those mucous membranes, and then it will absorb. If breathing has not returned within 1 to 2 minutes, you'll do the second dose up the other nostril. If you're using the injectable product, you'll take the vial and draw up the entire dose into the syringe, and then you want to inject it into muscle. So making sure that needle goes in straight, either into the thigh or into the shoulder. And then once again, there should be a second vial. If the person is not alert and breathing within 1 to 2 minutes, then you would inject the second dose. If breathing does not return spontaneously after 2 doses of naloxone, it's likely that you are not dealing with an opioid overdose. So there's a higher likelihood of cardiac arrest in these cases. And if that's the case, if they haven't returned to breathing, you would want to start CPR, just like you're responding to any other loss of consciousness and no pulse type of situation. In more rare cases, there's a likelihood that somebody has taken a high dose of fentanyl. There's some literature that shows that fentanyl may actually require a 3rd dose of naloxone or potentially even more. And that's why it's really important that you call 911 in these cases. So if regardless if somebody hasn't stopped breathing, what that reason is, you'd want to call 911 to get EMS to respond. And then finally, naloxone only lasts 30 to 90 minutes. There's a really high likelihood that the opioid in the body lasts much longer than 30 to 90 minutes. So as the naloxone wears off, that person can actually go back into an opioid overdose state, which is why it's really, really important to get emergency medical attention for that person. So calling 911, what should you say to the dispatcher? It's really important to let the dispatcher know the exact details of where you are. So not just the address, but if you're in a house or in a building, what floor you're on and what room that you happen to be in. Some people say to avoid using stigmatizing language like drugs or overdose, but instead reporting to the dispatcher exactly what you're seeing physically. So this person isn't responding when I tried to call their name, they're not breathing, they're turning blue, they're not responding. This really makes the call a priority for emergency medical response. And then when the paramedics do arrive, it's really important to tell them everything you know about who the person is, what drugs that they've potentially taken, and the number of doses of naloxone that you've given. They'll probably be able to tell whether or not the naloxone has worked because they'll have either returned to breathing or not. And if not, then they can continue CPR at that time. I think it's important to mention here also the Good Samaritan law. And this is something you can share with clients and patients, especially those who you know are using illicit substances. The Good Samaritan law protects people from any sort of prosecution or arrest from possession or drug paraphernalia or previous warrants if they're calling 911 for help. It's really important to get emergency medical assistance, and people shouldn't be afraid for what's going to happen when police or when EMS arrive. Step 4 is performing rescue breathing, so getting oxygen into that person as quickly as possible. And to do this, you want to put somebody on their back, tilt their chin completely up. Just like with CPR, you're going to sweep the airway, make sure there's nothing blocking their mouth or their airway. and giving 2 quick breaths until you see the chest rise. And then you want to do this again every 5 seconds. So giving rescue breathing until the person wakes back up and spontaneous breathing returns. So the way that they're teaching CPR these days, they're saying that you can do hands-only CPR if you are not a medical professional, and just do chest compressions. But this is really not the case for overdose. That's only the case for cardiac arrest. So if somebody has overdosed, getting air into them is actually the most important thing, not getting that heart beating. And so doing rescue breathing is actually necessary and very important. So if at any point during this overdose reversal, you have to leave the person, maybe it's to call 911, maybe it's to go get somebody else to help, you need to put them in the recovery position. So the recovery position makes sure that somebody is safe and their airway stays clear while you're away from them. And so that means laying them on their side, bending their knee so it supports them, turning their face to the side, and then having their arm as a support. And this will keep them safe from, if they happen to vomit or get sick as well. And then aftercare. So what should you do after somebody responds? It's very common for post-naloxone for people to feel really awful. It's going to cause withdrawal symptoms in somebody who is opioid dependent. Sometimes people will feel really sick, and oftentimes there's a drive to want to use again to make that sickness go away. But it's really important that somebody does not use drugs again while the naloxone is in their body, and that a re-overdose does not occur. Naloxone sometimes takes up to 8 minutes to have an effect. Like I mentioned, it lasts 30 to 90 minutes in the body. And so it is possible for somebody to overdose again. Make sure you call 911, have EMS there, and have them transported if they are willing to go. The likelihood of overdosing again as naloxone wears off depends on a number of things. One is the half-life of the opioid. There are some opioids that are very quick acting and have short half-lives, like fentanyl, and there are some that have very long half-lives, like methadone. So that will determine whether or not they go into that overdose process again. And the second is the liver and how well the liver is working and metabolizing those opioids in their body. So finally, what's a kind of recap of the steps? Number 1, assessing the situation, trying to get somebody to respond. So yelling their name in their face, giving them a hard sternal rub, making sure they're not breathing. Step 2, administer naloxone either up the nose or intramuscularly into a thigh or into an arm. And then if the first dose doesn't work after 1 to 2 minutes, then administering the second dose until breathing is restored. If breathing is not restored, starting full CPR. Third, calling 911, letting them know you see somebody not responding and not breathing. Step 4, rescue breathing. If you have to leave at any time, making sure somebody is on their side in that rescue position. In the recovery position, excuse me. And then step 6, staying with them, making sure that they don't use again, waiting until EMS arrives, and be gentle with them and with yourself. Probably not an intentional place where they wanted to be, and it's also can be very frightening to respond to overdose. So likely there will be heightened emotions, so be gentle. So these are the questions that I receive most frequently when asked about overdose. Or asked about, naloxone. Isn't this the stuff that they use in Pulp Fiction that they jam into somebody's heart? So the answer is kind of yes. Although we don't typically administer naloxone in the heart, it's done in the muscle, but it is something that they use to reverse her overdose in that movie. Isn't there naloxone in Suboxone? So yes, there's naloxone in Suboxone. However, naloxone is not absorbed well orally, which is why the medication doesn't cause people to go into withdrawal. The reason why there is naloxone in Suboxone is to prevent people from injecting it, in which case it would put them into withdrawal. Can Suboxone reverse an overdose? This is a really interesting question. And while Suboxone is not intended to reverse an overdose, it does have a very high affinity for the opioid receptor. And in fact, it kicks off most other opioids off of the opioid receptor and can put somebody into withdrawal and potentially reverse an overdose. So while it's not a good idea to rely on Suboxone for an overdose, it could potentially be helpful. How does the liver affect an overdose? Well, the liver is the main cleaning organ of the body. It metabolizes the majority of the substances that we take, including many opioids. And so if the liver is not functioning well, it can cause opioids to accumulate in the body, to not be metabolized, to last much longer in the body at higher doses. So for people who are older or have poor functioning livers, it can increase the risk of overdose. What if I give naloxone, but it wasn't an overdose? So the person should not have any effect from the naloxone if you give it and it happened to be cardiac arrest. So it's always good if you're not quite sure if it's a cardiac arrest or an overdose to try giving naloxone, and that will help you determine which it was. And then what if my naloxone is expired? Naloxone typically expires in somewhere between 12 to 18 months. Just because it's expired doesn't mean it might not work if you do have to respond to an overdose situation. But of course, like any medication, if something's expired, you know, it's best to replace it if you can. So you can go to your pharmacist, as Oyenda was talking about, and request a fresh dose. How do we prevent overdoses in our patients? So many people in healthcare have learned a lot about opioid risks in the last 10 years or so, including a lot of the counseling tips about not mixing drugs, not taking doses higher than you've been prescribed, et cetera. But I think there's some really concrete counseling tips that you can give people, whether they're using illicit substances or using prescription drugs. Of course, not mixing opioids with any other sedating medications or with alcohol. This can increase the risk of overdose, and using one substance at a time. So the Harm Reduction Coalition recommends that if somebody is using heroin along with other substances, that they use heroin first before anything else, so that they can see how the heroin affects them, and then use another substance following. Tolerance, use less when you're sick if you haven't been feeling well, if you haven't been eating or drinking enough. A few days of abstinence or being incarcerated can reduce your tolerance significantly and raise your risk of overdose. Knowing the quality of the drugs that you're using is also really important. So testing the strength of the drug before you do the whole amount, knowing which pills you're taking and where they came from, and being careful about switching between opioid pills, because there's not always complete cross tolerance between one opioid and another. And then finally, not using alone. So use with a buddy, develop an overdose plan with your friends or with your partners. Leave the doors open if you can. Call somebody to check on you, somebody that you trust. But most important, carry naloxone if you are using substances. A few other tips. So age and physical health, as I mentioned, a lot of times we see liver decline with age. So anybody who uses opioids, who has COPD, who has declining liver or kidney function, who drinks alcohol heavily, or who uses benzodiazepines should have naloxone on hand, regardless of the dose of the opioid that they're taking. Drinking a lot of water and fluids and continuing to eat is really important. If somebody has liver damage, the acetaminophen that's in opioids like Norco and Percocet can be especially damaging, so staying away from some of those Tylenol-containing opioids. If somebody has asthma or other sort of breathing problems, making sure you have an inhaler before you're using or while you're using. And then again, if you've been sick or lost weight, your tolerance has likely gone down, so using less. And then looking at the mode of administration. So injecting drugs and smoking drugs actually have the highest risk of overdose. There are safer ways to use substances. And so if you as a clinician can work with your patients or clients to transition them to an alternative mode of administration, this can be quite a bit safer and can reduce the risk of overdose as well. Thank you all for coming to our MedZed today. We are having a question and answer with all of our panelists right after this, so stay tuned, and thanks.